Hi, my name is Eshika, and I'm a junior at Harvard majoring in computer science. My research focuses on developing a deep learning-based tool for assisting surgeons when planning breast reconstruction surgery. Over 250,000 new cases of invasive breast cancer are recorded in US women every year. And 58% of these women in a late stage of breast cancer choose to have a mastectomy. Breast reconstruction is a common way to restore the quality of life of these women after they undergo a mastectomy. And more than 40% of women who have a mastectomy for breast cancer treatment choose to undergo breast reconstruction. So the DIEP flap procedure is the current gold standard for breast reconstruction because it provides natural results. The procedure involves harvesting tissue from the abdominal area with its supplying vessel and connecting that tissue to the target site. However, not every patient is eligible for this reconstruction technique, especially if, for example, their perforator vessels are too thin or damaged. And even though the long-term outcomes of this procedure can be really good, there can also be some complications like infections, hematomas, and hernias at the donor site. Unfortunately, it's not always obvious before the surgery if a DIEP can be performed or if another flap technique might be better suited for a particular patient. So it's an ongoing question as to how to better select patients to decrease post-operative complications. Since all patients receive a pre-surgical CT scan of the abdomen, as you can see on the bottom right, the main research question was how can we use automatic image analysis techniques to guide pre-surgical decision-making? Previous work done by one of our collaborators on the bottom left shows that patients who successfully received a DIEP breast reconstruction had significantly thicker perforators or vessels than patients which had to be converted to another flap technique. So with the goal of developing a guidance system for surgeons, we wanted to develop software to automatically measure the diameter of perforators from the CT scan. There were 4 phases to developing this tool. First, we train a model to segment the relevant muscle and use that segmentation to select the region of interest. Then we train a vessel segmentation model and measure the diameter of the resulting vessel. For this project, I'll focus on the vessel segmentation model. We train models with 2 different architectures that have been shown to perform well on the vessel segmentation task. The first is the U-net on the left, and the second is the deep vessel net, which is a more traditional convolutional architecture, as shown on the right. I trained these 2 models on a synthetic vessel dataset with 28 cases for training and 14 cases for testing. Each case was split into smaller 3D patches, and these patches were then classified. We found that the FCN had a higher sensitivity and specificity than the U-net. These metrics were quite high, indicating that the model is generalizing well and that these models can then be transferred for use on real cases. We successfully trained a deep learning-based model for vessel segmentation on synthetic vessel data. So now we can fine-tune this model on real cases and use these vessel segmentations to extract more information about the patients and assist surgeons in planning their procedures. Overall, this approach has the potential to significantly shorten operating times and lower healthcare costs for any free tissue transfer reconstruction. Thank you.